wakati hiyo county bado kuja. Tulikuwa na Dr. Moja Mandera mzima, the whole Mandera.
Health is the area that actually consume close to 30% of our budget.
Wazee na leaders ya kutoka county ya Mandera yote wakati hiyo alikuwa wanaomba DC doctor. Bana DC sisi ustala kuna daktari, hakuna doctor hakuna. Moja alikuwa Mandera hiyo naye ameenda hali hatari, alikuwa wanaongea.
Each settlement requires a health facility on a bare minimum, a dispensary. What we have pledged during election in the year 2022 was very simple, basic, implementable, sustainable, and realistic. At the onset of devolution, we are like having one medical doctor and less than 200 health personnel across the entire district then. During the 10 years of the first 10 years of Governor Robert's administration, a lot actually happened. The number of health staff actually jumped from the 200 to about 1,200. As we speak today, we are talking about 1,600 medical personnel across Mandera County.
During inauguration, we had a lot on the table, and that included all sectors, starting with healthcare transformation, education. And that is why His Excellency, the Governor, started implementing and set up a task force, established a task force in both health for healthcare transformation and education. The task force report provided so many recommendations. And if you look at all those recommendations, we have managed to ensure that those recommendations have been achieved.
Vision is not a poster on the wall. It is a mother who no longer walks 60 kilometers away to deliver a child. It is a child who receives their first vaccine in a village and not in Nairobi. It is also a dialysis patient who sleeps in his own bed in Mandera County Referral Hospital and not in a queue in Garissa County. This is the vision of the department.
Mandera County Teaching and Referral Hospital has recently launched a new well-equipped renal unit. His Excellency, the Governor Mohammed Adan Khalif has recently launched 5 new machines that are very modern, and they are really helping our community now.
Nimeleta mzee mgonjwa kutoka Udole. Nimeleta hapa hospitali ya Elwak Referral Hospital. Wamepokelewa vizuri, wamepata huduma, madaktari wamepatia service, maji yamefungiwa. Sasa hivi amelazwa hospitali, ako kwa kitanda. Wako kwa shughuli ya kushughulikiwa na kuangaliwa zaidi. Tunashukuru sana, huduma inaendelea vizuri. Wale wako hapa staff ya hospitali, madaktari pamoja na madokta wanatoa huduma sawa sawa, hakuna shida.
On the service delivery, we have really improved. That's why our numbers are very high. We have taken of the referral actually being reduced because of operationalization of theatre at Banissa and the operationalization of theatre at Lafay. And then we are doing also operationalization of theatre actually at Kutulo.
For the last 3 years, all the sub-county referral hospitals in Mandera County have undergone major expansion and equipping with the necessary equipments to provide comprehensive healthcare services. In Lefi sub-county, for the first time since independence, theatre has been operationalized by His Excellency the Governor. The first cesarean section has been done in Lefi sub-county hospital by our doctors, and this is really a major milestone since independence for the residents of Lefi sub-county. On the same breath, a modern radiology unit has been constructed and is being equipped to provide diagnostic services. Ultrasound and X-rays will no longer be done. People will no longer travel for these services. So it will be done in Lefi sub-county hospital. Also, a modern laboratory has been completed and is being equipped so that specialized diagnostic services is done within Lefi sub-county. And this is also another major milestone for the residents of Lefi sub-county.
wax kasta oo shaqo ay kasta oo maaragtaa loo baahnayo waa qabtay wixii tabartiisa ahay ilaahay wixii asku garab galay waa qabtay nin maaragta dhaliil aan ka tabanayna ma aha nin dhaliil lehna ma aha wanaag badan aad noo sameeyey isbitaalka qaybta qalliinkii isbitaalka Lefi dadka waa hadda waa lagu qalaa oo maaragtaa meel kasta oo la keenay meel uma dhaafaan gabdhaha maaragta ku umalaan oo hadii maaragta dhalmuxdo qabatana waa lagu qalaa qofka xanuunsan saas amal u baahdana waa lagu qalaa rifaal u baahan doctor fiican oo wanaagsan oo qayr badan maaragtaa liyaada
Initially, the Takaba resident and the Mandera West resident used to go to Elwak Sub-County Hospital for X-ray services. They no longer go to Elwak. Now we have X-ray services available in the hospital for diagnosis of our patient. The next important thing is we receive a number of equipment which is used for diagnosis, which is used for care of our patients. These equipment include the new biochemistry machine, new full hemogram machine, and also a 4D ultrasound machine, new beds for our patient. This equipment majorly helps our patient in diagnosis and also in management.
For the health infrastructure, through the county government of Mandera, it has undergone a transformation and improvement. There's a new infrastructure development like a modern laboratory, wards, new modern maternity and newborn unit, which is almost complete, ready for launch.
dowladdeena oo dadaalka noo muujiyeen oo isbitaalka noo dhiseen markii guriyaasha fiican oo noo dhiseen oo dhakhaatiirta badan la keenay qalabkina iyo adduunka wixii oo isbitaalka laga baahan yahay xagga oo qalliinta radiator iyo bijada x-ray wax kastaba ma ayaa noo la keenay hadda waxa dhibaato u qabnina malaha.
We have operationalized 22 dispensaries for the last 3 years. We have upgraded after structural improvements 20 dispensaries and upgraded to health centers. We have equally registered 26 dispensaries and gazetted them, out of which 10 were new dispensaries that were constructed. This will improve access and utilization of services across the settlements of Mandera County. We are planning to construct new dispensaries across the high-volume villages, and we have linked community units with most of these primary facilities that will improve access and utilization and referral of services.
ninka taas adeegsato alxamdulillaah wax baan ka rabaa atiraas waxa iyaga alxamdulillaah ku qabta waa shaqaale sidiis ay kuugu imaado wanaagsan waa maasiidin dawladii noo qabatay isbitaalkaas mataan noo bilowday oo noo dhistay way ku mahadsantahay waxa sababtaas gabdhaha malkaamiri waxa waaye waa meesha boodhaga oo Itoobiya iyo alxamdulillaah Kenya xuduudooda ku taala waa meesha ugu dheer tramo ma giliira oo hadda istaalka weyn oo Ramo ku yaal iyo alxamdulillah liira 140 kilomitir ay noo jirtaa Ramo baanis waxay noo jirtaa 75 kilomitir ay noo jirtaa saas ida awgeed alxamdulillah qoftii soo foolato waa loo qaaday meesha loo qaadi jiro loo cariri jiray hadda waxa waaya waa ka kaaftoon iyo waxa waay waxaan ugu kaaftoon gurihiin oo dhisay daraadooda ugu kaaftoon
Tumetumwa na governor wakati alikuwa anapita juzi, alisema lazima hii dispensary kuwe operationalized, and that is why we are here today.
Isbitaalka maanta waa naloo furay. Allah idin barakeeyo. Shaqaalaha, dhaqaatiirta, dhammaantood Allah barakeeyo. Kuwii isku waaro alfadan Allah naga dhiga. Isbitaalka anagana kii hore u socda Allah ka dhiga. Intaan ka codsan jirno nabadkeed u soo oon jirnay maanta waa faraxsanahay. Hawooyinka qosolkooda iyo Allahskooda uma malayn kartid. maagan alla jisakala waxaan rabnaa inay shaqadan hore noogu socoto oo isbitaalka saan anaga ka rabna aan ka helna hooyooyinku umalisida ilmaha caafimaadkooda dhammaan aan helnaan rabnaa.
We have procured 3 ambulances.
Annambarana first you isbitaal baana saatin talisa first operation anit ana nuina maanta maternity tentu lafti tentu guddo nami sablate harakawja ni ilman qabat baka goljo la fenta ni ilman qabat ambulance la jira ambulance lena kana sawja nu yam sablate nu brejiti akasi ya ma jira am wana ni mahmad adan qalib gafana keenna qar galat qab damalle galat qab.
We have new ambulance which is stationed at the facility. This new ambulance helps us in referral of our patient, either from the lower level facilities like level 2, level 3, and it also helps us in referring complicated case to Mandera County Referral Hospital.
Hospital كونيني قابدر dispensary يورب من قدام آخر كنوس في جبنا كرني ناني health center نوسشة hospital قدام بعد دقيقة سوني أولان ما تقوليا كنا zero home delivery injurtu isbitaalada khalikan woodu woodza gudati arman guljoteja armalleni borashmitej garalle baas gubata garalle guba gubata ulatana wana maanta lama wole fakata gibi arman dalu jirta maanta nam ambulance dakhashan ka sadju soo ooni fi fuute arman dufte arman dalti tada dabalo jibso referrali baas 100% dakhashan case.
New ambulances that we received from the county government. That one also it has is the referral chain and also contributed to reductions of mortality.
The people of Mandera have elected a governor who promised you and has fulfilled at least 80 to 90% of the promises in just 3 years. And we will not rest until every dispensary has a solar light, every theater has a surgeon, and every child in Mandera has a future. And we are not asking for applause, we're just asking for partnership from you people. Please register for SHA, demand your CHPs to visit, and hold us accountable to our scorecard that we publish every quarter. Because in Mandera, health is not just a department, it is our dignity.